Hi, I am Dr. Katie Lee, and I am the CEO and founder of Collective Health Society. And I got into dentistry and oral systemic health really through my own experience. When I was 14 years old, I crashed headfirst into a telephone pole and broke everything in my face from my eyebrows down and lost a bunch of teeth. And over the next 4 years, I had 9 reconstructive facial surgeries to help fix my teeth and my face and my jaw. And during that time, I suffered a lot of inflammation, a lot of infection from dental issues, and my liver enzymes spiked and my kidneys started shutting down because I became severely malnourished. And so I learned at a very young age just how important your mouth is to your overall health, which led me into dentistry so that way I could help other people. There's two main connections that I think really surprised me about oral health and overall wellness. The first one is just how connected our oral health is to our gut health, which makes sense because the mouth is the start to the gut. But a lot of people are really concerned about their gut microbiome, which they should be because our gut is very important. But what they don't understand is that the bacteria get to the gut through the mouth. So we swallow over 1 billion bacteria a day. We also have bacteria in our mouth that go into our bloodstream and get to the gut. And so you cannot have a healthy gut without a healthy mouth. And then the second connection that really surprised me and makes a really significant impact is just how important your oral health is to the male and female reproductive systems. So we have a massive issue of infertility in this country, and oftentimes the mouth is overlooked as being part of that connection. There's two main ways that conditions in the mouth really affect the rest of the body. And one is going to be bacteria themselves. So there's certain pathogens in the mouth that will get into the bloodstream through the gum tissue and travel to distant areas in the body where they should not be. And once they take residence up in these distant organs, it can cause a lot of issues like chronic disease. For instance, heart disease and diabetes, those are very common. The second way that the mouth contributes to systemic disease is by causing chronic systemic inflammation. So when we have an issue with bacteria in our mouth, that's going to elicit a local inflammatory response. And then that inflammation can actually disseminate throughout the rest of the body. So we have a bacterial problem, we have an inflammation problem, and we have an immune response problem. There's three main oral conditions that contribute most to systemic disease. One is going to be airway. So a lot of patients are very unfamiliar with the fact that our airway, or how we breathe, directly affects not only the health of our mouth, but the rest of our body. Another issue is going to be the bacteria in our mouth that contribute to gum disease cause a lot of systemic diseases because we have a bacterial issue in our mouth that creates an inflammatory response and then elicits chronic inflammation. And then the third way that our mouth contributes to systemic disease is by having abscesses or infections. These typically occur around the roots of teeth that have had root canals or teeth that have died and the patient is just unaware of that. But we know that over 50% of all heart attacks and strokes are actually caused by oral bacteria. And there's a very strong link between endodontic or root canal abscesses and heart attacks and strokes. Because we know that the mouth is connected to over 57 systemic diseases, it is absolutely critical that we align as healthcare providers to help our patients achieve optimal wellness. So in our office, we actually have certified nutrition specialists that can treat our patients. We have a medical director, a myofunctional therapist, and a registered nurse that all work together to collaborate to treat our patients. Now, if a patient has a provider that's not part of my clinic, after I see every single patient, I do send a letter to their healthcare provider sharing their oral microbiome test results and sharing with them my findings, because together, working together and collaboratively, that's how we're going to help our patients improve their chronic symptoms and reduce systemic disease. So several years ago, I had a young woman come into my clinic and she was seemingly healthy, had no systemic issues that she had brought up to us. But once we started doing her exam and cleaning, we noticed that there was something severely wrong with her health. Her gums were bleeding profusely just by barely touching them. And when we started questioning her about everything, she really didn't know what could be going on. We did a salivary microbiome test and an enzyme test and realized that she had a very severe infection, Fusobacterium nucleatum. So we treated her in the office, but then I also sent her to her primary care doctor who ran a gamut of tests on her. And she was actually diagnosed with systemic endometriosis and had no idea. She even had lesions in her lungs. It's very common that people will come in and not know that they have something going on. And it's not until we start digging in and looking at the mouth and relating that to their systemic health that we'll see something. And in fact, 64% of people who have endometriosis have oral FN in their lesions. So anyone that's suffering from any kind of female issues definitely should come get a salivary microbiome test. So if someone doesn't have dental insurance, that doesn't mean that they can't receive this state-of-the-art, best in practice care. So what they can do is come see me at my office. Dental insurance really doesn't cover these types of tests and treatment anyway. So what we've done at our practice to help make this care affordable is we have in-office membership plans that will allow these patients to get a free test each year. They also get discounted services that we provide here. And then we do in-office payment arrangements and financing with 0% interest, just to make this state-of-the-art care affordable for everyone. The best way to book an appointment with me is you can go to my website, www.collectivehealthsociety.com, and you can book an appointment straight away with me from the website that fits with your schedule, or you could give us a call at 303-223-2343.